All right, welcome everybody. Thanks for being here. I'm Tim Malinsky. I'm the mayor of Cottonwood. This is the Cottonwood Strategic Planning Retreat. So thanks everyone for being here. We're just getting back from break and working into our next hour here. So we have 4 folks that are going to present to us here this hour. Representatives from Yavapai Food Council, Verde Valley Medical Center, Verde Valley Senior Center, and Spectrum. So what I'd like to do is have all the representatives come up here, please, and have a seat. And the way this is going to work today is we're going to give everyone 10 minutes to present. And I know there's been some confusion about whether or not you've got 7 minutes, but we're going to give you a full 10 minutes to present, okay? And at the end of your presentation, please just have a seat back at your table. And then after all the presentations have been made, we're going to take questions and answers for the duration of the hour from the council. So the whole panel will have an opportunity to reply to questions. We're doing a really good job at staying on track here, keeping everything to time. I'm going to hold us to task. We do have, I pilfered my 3-year-old daughter's bedroom this morning. I stole some props from her to help us manage time. So again, you have 10 minutes to present. At 9 minutes, you're going to hear a chime, okay? And then at 10 minutes, you're going to hear a cowbell, which means you have to sit down, okay? And if you finish on time, I will give you a $5 coupon for our historic home and building tour. Okay, so there is a little bit of incentive to wrap things up on time. And then if you do finish early, of course, that'll just give us more time for questions and answers at the end. So what I'd like to do right off the bat here is call up Amy Aosi. Is that how you pronounce? Aussie, I apologize. She is the executive director from Yavapai Food Council. Thanks for being here.
Good morning, everybody. I'm Amy Aosi with Yavapai Food Council. Thank you for inviting us today. A lot of times we don't make it into other community agendas, and we really appreciate that. So a little bit about Yavapai Food Council. We were founded in 2009 as a grassroots nonprofit in the Verde Valley. We started as Verde Food Council. And I joined the organization in 2012. And we focused on a mission. Our mission statement at that time was developed into supporting those who feed the hungry. And we have two basic initiatives. We have a child hunger initiative, and then we have an emergency resource initiative that focuses on the supporting the emergency food providers. In 2013, we introduced the Yavapai Food Neighbors Project, which is a green bag community project. We do operate that here in Cottonwood. It was brought here about 2 years ago, and it gives community members an opportunity to fill reusable green grocery bags with groceries, and then shelf-stable foods, and then every other month we have a collection event in 5 different communities. All of the bags of groceries are picked up at the donors' homes and brought to the collection sites, sorted, and then distributed to local emergency food providers from those communities. We do operate here in Cottonwood, and the Cottonwood Project supports Camp Verde, Cottonwood, Cornville, and Clarkdale. In addition to that, we have been operating weekend backpacks for hungry kids since our inception in 2009. Originally, those weekend meals were just provided to kids in Beaver Creek, Village of Oak Creek, and Sedona. Over the last couple years, we've expanded the project. We now support weekend meals to kids throughout the county. I'm going to leave you with some materials that has more information on our weekend meals program. The third project that we have is a partnership with Department of Economic Security as a SNAP application assistance provider. There's only 2 DES offices in our county now, Cottonwood and Prescott Valley. So we focus on, Yavapai Food Council focuses on rural support. We have volunteers that actually go out into rural communities with mobile equipment and help people apply. We also have a SNAP center at our Sedona office where people can come in to the office, make appointments, and come in and be served immediately. The newest project that we have is the Bountiful Kitchen, and this is a nonprofit prep kitchen where we prepare shelf-stable or cold breakfasts and lunches that specifically go to schools that do not have commercial kitchens and are not providing food for kids. These schools need to have at least a 50% population or student body that qualify for free or reduced meals. Since starting that project September 22nd of this year, we have delivered almost 18,000 meals between American Heritage in Cottonwood and American Heritage in Camp Verde. We're adding another school in Cornville, Desert Star, in February. And we hope next year to be able to expand this to childcare and childcare and adult care centers. The other project that Yavapai Food Council handles, we offer the only Yavapai County Emergency Food Resource Directory. All of our emergency food providers are listed in a directory that we update quarterly. It's used at a state level as well as local. It talks about the services that are available, what days those services are available, where the hungry can go to get food that they need. So the reason I'm here today is because a couple years ago, the Weekend Backpack program in Cottonwood was eliminated. And we started fielding calls almost immediately. When Central Arizona Food Bank closed, Sodexo's partnership with them went away, and all of a sudden, there's a gap, a need for those. And this year, we started talking with the Spirit of Joy Lutheran Church, who is they're doing about 30 a week right now between Clarkdale, Cottonwood. And we're getting ready to partner with them to expand that to Camp Verde. Yavapai Food Council has in our mission this year, 2017, to expand our Weekend Backpack program to Cottonwood and Camp Verde with as many as 500 backpacks a week. I have a packet I'm going to leave with you. This packet has an example of what goes in our weekend meals packs, what communities we're serving right now. A year ago, we adopted the Mayer School District. For example, one of their schools, their elementary school, at the time that we adopted the project, had 408 students, and 98% of them qualified for free or reduced meals. So we started our pilot doing 25 weekend meal packs with them each week last year. This year, we're up to 100, and I think we're at 110 a week right now. Our goal is 125 this year and expand that next year. I see that kind of effort in Cottonwood and Camp Verde. So we'd like to start this year with volunteers from the community, with recognition from the council that Yavapai Food Council is not a Sedona organization. We're really looking at hungry across the county. We have 1 out of 3 kids that are food insecure, 1 out of 5 adults, and 1 out of 6 seniors in Yavapai County. And those facts hold true here at home also. So we would love to have the council's support in this. If there's any opportunities for grant funds, for fundraisers, for teams of volunteers a couple times a year or on a more regular basis, we will be packing the food, a lot of which comes from our Yavapai Food Neighbor Project. We'll be packing that once a week and have drop points where volunteers will pick it up and actually distribute those backpacks to schools. The other thing that's important to keep in mind as we expand the backpack program is that by partnering the program with the Yavapai Food Neighbor Project, our cost for each bag that we pack for a 2-day weekend, our cost is $4. In most communities, we have a partner that splits that with us, or multiple partners, whether it be faith-based or a nonprofit. As we move into the Cottonwood expansion and Camp Verde, we don't have those partnerships in place at this time. I'm writing grants, but it is something that we would absolutely appreciate any kind of consideration for funding. So,
Ms. Ossie, thanks very much for being here. I appreciate your presentation. I think you may have a scheduling conflict too, is that right, where you need to sneak out of here a little bit early?
yes, I apologize and thank you.
That's okay, really. Thanks for making the time to present to
Yeah.
us today.
Wonderful, thank
Safe
you.
travels. Sure, absolutely.
Since you're leaving, I don't know.
Sure.
Do you have a place here in Cottonwood where people can volunteer for the backpacking?
So
Not-
the way it'll work is we partner right now with Spirit of Joy. They have their own group within their church that does the packing. We will be packing out of our warehouse in Sedona, and so volunteers are welcome to come once a week and help us pack there. The other thing is when we deliver the meals daily to American Heritage, we'll pack up all the bags that have been packed in Sedona and bring them here, and we'll need volunteers to meet us, to take those and distribute them to the other schools in Cottonwood, and then we'll have the same thing happen in Camp Verde.
Thank you.
Yes, you're welcome.
Thank you very much. Safe travels.
Thank you. And can I leave?
Absolutely, of
some-
course. And if you wouldn't mind to leave a card for me on the
Each
table.
one has a
there.
card
Okay.
on it, and please
Very
feel
good.
free to reach out to me by phone or email.
Okay, thank you.
Thank you.
Okay, next we have Barbara. Is it Firminger or Firminger? I'm so sorry. I should have asked you. Okay. She is the new Chief Administrative Officer.
Yeah, I can say that for another couple months.
Okay, for the Verde Valley Medical Center. Thanks for being here. Appreciate
Oh,
it.
well, thank you. No, this is exciting. It causes me to start having my brain cells fire. I mean, great example when I was just thinking about this, we're renovating our cafeteria and we're talking and expanding it, and we're talking about having some subsidized senior meals and so forth for the community so they could come in and have hot meals. So, you know, hearing this, there's a great synergy and collaboration we can do.
Great.
So I will spend most of the time talking about kind of what I think we can do in the Valley collaboratively. But Verde Valley Medical Center is part of the Northern Arizona Healthcare, which I came from the Valley, so I was actually astonished to know that there were 3,500 employees in the system. And it is quite large. And it is no longer just two hospitals that we have, you know, over 100 physicians. We have a joint venture with a home health company. We have a hospice. So it's quite the health system, and we're looking to, our real mission is looking to serve the community basically from cradle to grave. So we really want to collaborate where we can with those organizations to promote health and a healthy lifestyle. But where we see there's a community need, we will, you know, start up new initiatives. So it's really not just a hospital, it's beyond the four walls. We're excited because we engaged NARBA and the NAU to do a really rigorous community needs assessment for both the Verde Valley, Flagstaff, and some of the other surrounding areas to look at everything from a health perspective, but a psychosocial. As we all know, health is only one component of a healthy lifestyle. There's food, there's shelter, there's safety, and that's why we all have to work together, because we can provide great primary care, we can provide an emergency room, but if somebody goes home, as we know, and doesn't have a safe environment, doesn't have their prescriptions, doesn't have food, heat, they're going to be back in our emergency room all over again. So with that kind of the perspective, our vision in Northern Arizona healthcare is basically three fundamental things. We want to be the model health system, but we want to be the choice. What does that mean? That means patients need access when they want it and how they want it. It's not a build it and they will come. It's how do we get them access in a way that they can. Great example. Urgent cares, they started up because people couldn't get to their primary cares from Monday through Friday, and people couldn't afford emergency rooms. Well, we're taking another step. Telemedicine is really the forefront, I think, in how healthcare can be delivered. And we've made a significant amount of investment in that. And we have a telemedicine access, and we can certainly get you that information with a very small fee, much less than a primary care office or going to the urgent care. You can get online, even on your phone, and you can speak with a primary care provider and even some of the specialists. So we're looking to really promote that tremendously. That's great for people that are in the home, can't get to the emergency room, can't get to their primary care, or it's on a weekend and they need access. So, and it's called Be Well Now, and we're actually promoting it within our organization as well. We recognize that there isn't great access to primary care. There's more of a need for primary care than what we currently have, and this is one of our abilities to serve that community. We're also going to be working with NextCare and see what we can do collaboratively with them in order to provide additional support services. Spectrum is our partner because, as we know in the Valley, there's an awful lot of mental health and substance abuse that, again, we can handle the medical needs, but if we can't handle the person holistically and their mental and social, we're not really doing them a good favor. So we also focused a lot on quality and reliability. So in the last 7 months since I've been there, when I first got here, we were told that the emergency room physicians, one, it was overpriced, and two, we had emergency room physicians coming in constantly. They didn't live here, they didn't know us, they didn't even know the computer system. So we've worked very diligently in the last 6 months to hire emergency physicians that live in the area, that are full-time, that really feel a part of the community. And I think that's our strategy overall. We want people to live in the community, and we want them to be invested in the community. That's really the best way you can provide care. If you feel like you're caring for your neighbor, your friend, you're going to do a pretty good job. So we're well on our way. Probably in the next 6 months, we should be almost completely hired with full-time emergency physicians. We also have the Flagstaff group, the emergency physicians. They're board certified, Trauma 1 level physicians that are going to come down and support us shortly. What we've really done in the last year is look at what are the strengths of both organizations and how can we work with them. So the hospitalists and the intensivists up in Flag are supporting us. We have the radiology group up there that's also supporting us down here. So we really provide, better care than we have in the past. Now, other than access, one component of access is affordability. And we just recently did a study on our costs and what we charge. We are really high. And I think that in the past, every year, Verde has raised its prices, and that's how it's made its budgets. I'll be very clear. We've now priced ourselves that we're too high in many services. So we've started to reduce our prices, recognizing that we need to be affordable to the healthcare community. So we have affordable prices for imaging at the MIC, and we're going to continue to roll that out. Trista's here to help me in getting the word out as far as what the affordability for a lot of these things are. We're also we have a residency program for internal medicine, so we're going to look at putting together a continuity clinic. So if people can't, with sliding fee schedules, if they can't find primary care, if they go to the emergency room and they need some follow-up, we'll have that available as well. So on to, and hospice. We have a beautiful hospice and a joint venture with LHC. We were only able to take 5 patients before. We've now expanded it, so we're at full capacity with staffing, and so we can take 10 patients. I think there's a misnomer. We do actually have a sliding fee schedule for the hospice. So we have had people who have paid literally $10 and $12 a day. So we take that into consideration when we, and it used to be when we only had 5 available beds, it used to be just people from our hospital, but now that we've been able to expand it, we can take referrals from outside as well. Lastly, what challenges do we have? Recruiting. And, you know, sometimes you think, well, nurses, I'm amazed at all of the different technical people that we need to have, everything from an MRI tech. I think it's harder to find an ultrasound tech, frankly, from what I've been hearing, than it is to find a nurse. So we struggle with that. We want people, I laugh because I came from the Valley, and everybody I tell that I moved to Cottonwood and Cornville look at me like, I've never heard of that. I live in Phoenix and I've never heard of Cornville. Where is that? And, you know, so you say near Sedona. Oh, okay. We need to promote ourselves more. We need to really show what a wonderful community this is. You know, we need to look like a vibrant community so we can recruit people who are younger that can take care of some of the older populations. We need to promote our schools and promote the lifestyle here because that will help us and the community tremendously. We also have an issue with trailing spouses, so we might recruit a physician or we might recruit a nurse, but then we need to have jobs available for those other people. Is that my cutoff?
Yeah, 1 minute left before the cowbell goes off.
It's better than the hook, isn't it?
Yeah.
So, so in summary, if we can work with, you know, Yavapai community to maybe educate some homegrown people, I think they're much more likely to stay here. So we can offer different, you know, technical jobs, and we can do a work program in addition to that. And again, promotion. Trista and the marketing group have done a phenomenal job, which will be rolled out sometime in the spring, talking about how wonderful it is to move here and come here. And I think if we can collaborate with other organizations to also promote what a wonderful place this is to move here, I think that would be terrific.
Thank you. Thank you
right.
very much. All right, next up is Elaine Bremner, who's the director of the Verde Valley Senior Center. And did I go over the chime and the cowbell thing? Okay, I'm just making sure. Because we're very serious about that cowbell. Elaine.
In our organization, we have goats.
Okay.
That praise. That's much nicer.
Goat.
Must be taller than me. Okay. Can you hear me all right? Okay.
Yes.
Well, good morning. Thank you for this opportunity. And Right Honourable Mayor Tim Alinsky and members of the City Council and Your Worship. I'm going to begin by reading our mission statement. That the Verde Valley Senior Citizens Association is a non-profit organisation whose primary objective is to enrich the lives of the senior citizens and Verde Valley communities by providing wholesome meals and promoting social and recreational activities for all to enjoy. I submit the following information for your enlightenment and ponderance. Our program is more than just a meal. Our menu is planned to provide 100% of the US nutritional recommended daily allowance and is approved by a certified dietitian. In addition to meals, clients benefit from the daily contact of delivery drivers as well as the calls and visits from our networked case management team who regularly check on our clients' well-being. All clients enrolled in the home-delivered meal program are assessed for health status and nutritional needs and are case managed. Every time I come here, I try to throw in something else that you might learn from me. I hope that's, that you realize these things. These are freshly prepared meals, by the way. Benefits and impact of our program. Well, good nutrition is the foundation of health, regardless of age. Research shows that older adults who participate in senior centre programs can learn to manage and delay the onset of chronic disease and experience measurable improvements in their physical, social, spiritual, emotional, mental, and economic well-being. Eligibility for this program, that the following guidelines under the Older Americans Act. Eligible clients of the Verde Valley Senior Centre's Meals on Wheels program are homebound and frail elderly, age 60 plus, that are so by reason of illness, disability, or isolation. Other eligible individuals include a spouse and/or disabled dependent of a client, regardless of age or condition. And I do want to mention that many of our clients are veterans, that are combat veterans. Other eligible individuals, the other eligibility criteria is residing in the Verde Valley Senior Centre's contracted service delivery area. This includes Jerome, Clarkdale, Cottonwood, Cornville, Lake Montezuma, Rimrock, Camp Verde, Middle Verde, Verde Lakes, Verde Village areas, and any other outlying rural area other than Sedona and Village of Oak Creek, and you know they don't consider themselves part of the Verde Valley. So, when routes are full and there are no open spaces for delivery, or when funding prohibits adding additional elders, the priority for service is reviewed and the person is placed on a waiting list in order to meet the established criteria. Every possible effort is made to avoid placing any individual on a waiting list. However, we currently have people on a waiting list to receive a meal, and they're old. We'll talk a little about cost. Any donation, no matter how large or small, is always greatly appreciated and accepted, although no client will be turned away due to inability to contribute. The suggested contribution for qualified home-delivered meals is $5. Private pay, we have a private pay program, and this is available to individuals that do not meet the mandatory criteria for our donation based on for the donation-based Meals on Wheels program. Anyone over age 60 is eligible for the private pay program depending on availability on the routes. What are the meals like? Clients receive a wholesome, nutritious, home-cooked meal prepared by a well-trained and certified dietary staff. The meals are considered to be a no-salt-added diet. Fresh fruits and vegetables are used whenever possible. Our meals are high in vitamin A, vitamin C content, fiber, and grains. Meals, and now I'll talk about delivery. Meals are delivered Monday through Friday between the hours of 11:30 and 1 p.m. normally, except when our routes are getting a little bit longer. But this is important that our drivers are required to obtain a level 1 fingerprint clearance card and have background checks. So there's not just someone coming off the street to go across the threshold of a vulnerable adult. And here's some statistics for you. In the last fiscal quarter, the people within Cottonwood city limits received 4,237 home-delivered meals and more than 3,000 congregate meals. More than 15,000 meals were served during the last quarter, and approximately 65,000 meals were served during the last year. That's a lot of cooking. And in Cottonwood, the average amount donated in Cottonwood was 62 cents per meal. We asked for 5, we got 62, okay? An average for all of the home-delivered meals, $1.15. In the same quarter, the average cost of preparing and delivering the meals was between $8 and $10, depending on the cost of food, cost of gasoline, and what you're serving, you know. Verde Valley Senior Centre services, I think you all know that we're a gateway to connecting older adults to vital community services that can help them stay healthy and independent. And we offer a wide variety of programs and services, including meal and nutrition programs, Meals on Wheels program, the information and assistance, health, fitness and wellness programs, evidence-based programs like Matter of Balance, chronic disease self-management, which helps people with conditions like diabetes, heart disease and arthritis learn how to reduce their symptoms, eat well, and communicate with their doctors. Regular blood pressure and glucose screenings, volunteer opportunities, social and recreational activities, educational and arts programs, intergenerational programs, job training programs, greenhouse growing. And how are senior centres funded? Not very well, but The incredible shrinking dollar comes into play here. To maintain operations, senior centres must leverage resources from a variety of sources. These include federal, state and local governments, special events, public and private grants, business, bequests, participant contributions, in-kind donations and volunteer hours. Regular surveys are conducted with our home-delivered meal clients to assist us in meeting their needs. Okay, I've got to get this out. Okay, is that my clock? I have 1 minute?
No,
Do I have 1 minute?
You're all right.
Pardon?
You're all right. That's a phone going off. You've got time.
I'm sorry. Okay. Then you're going to give me 15 extra seconds. Okay. So the two top challenges, I won't go over all those other things because there's so many of them, but the two top challenges in achieving our mission is, of course, you expected this, money and volunteers. And more than 75% of our clients cannot contribute a dime for the services received. And being bogged down in red tape, that's another thing. Just because you get a nickel, you spend 10 grand on having someone shuffle the paperwork, you know. And the increase in minimum wage is going to be detrimental to many seniors in the state of Arizona. Food costs are on the rise, gasoline is on the rise, and those items have a huge effect on our program. We've formed partnerships with different agencies, but the one in particular is Spectrum Healthcare. We have a training program in our dietary department and in our greenhouse. They provide the coaches, and they do one-on-one coaching with their clients, and then the objective is to get that client job ready. So we are able to enhance existing skills, develop new skills, and hopefully they can get out and get a job. I'm all about jobs. You know, I'm all on the Workforce Development Board for Yavapai County. And this is a great program, and we could not get through the year without that program because of the cost of paying for labor, yes? And how can the Cottonwood City Council support our mission? Well, it just always comes down to money and volunteerism, especially with nonprofits. In the past, City Council members have been very supportive in attending fundraising events, and we've been truly thankful for their recognition of the plight of the elderly. Because when you attend an event or come over to the Senior Centre for lunch, you're being recognised as someone who cares about our elderly population. We always introduce you. And perhaps you could form teams to volunteer, you know, some of your employees. 1 day a week for 1 to 2 hours, you know. It's a good idea, and it's great for people to get out and become better educated about the plight of the elderly. You can donate. You can make tax credit donations. But another thing is you can have a grant writer to help the nonprofits. They used to have, do I have a minute or am I done?
No, that's your cowbell, I'm sorry.
That's the cowbell? Okay. Thank you so much.
We'll
I
take
almost
questions.
made it.
We'll take questions, so you'll have more
Pardon?
opportunity. We're going to take questions as well.
Oh, okay, right.
So you'll have more opportunity
Okay.
to speak. Thank you very much, Elaine.
That's it. Thank you very much. I have a handout.
All right, so next up is April, is it Razzo? Yes, she is the CEO of Spectrum. Thank you very much for being here.
See if I can adjust this. Thank you, Elaine. Appreciate your kind words about Spectrum. Thank you all for inviting me here, and I just want to say as an aside that I think this is such a great idea. And so I commend you on expressing an interest in the different programs that are available in the community. So yes, as you mentioned, I'm the CEO at Spectrum Healthcare Group. My name is April Razzo, and I'm asked to speak about Spectrum a lot, but very rarely in 10 minutes, so I'm going to try really, really hard to cover everything that I feel like I want to get out there to you, and I appreciate hearing from everybody here about our partnerships as well. I wanted to make sure that that was something that we highlighted because I think that we do a really good job in the Verde Valley of partnering around some of these things. So Spectrum is a whole health care provider in the Verde Valley, and we're responsible actually for serving the behavioral health needs of all Medicaid consumers living in the Verde Valley. And so when I say responsible, what I mean is that we're responsible for any Medicaid eligible people that are either on Medicaid or could be on Medicaid, whether we know about them or not. And so that sounds kind of like a tall order. But part of that is being aware of, outreach efforts and how we can get people engaged in our services. And so for us, the Verde Valley does include Sedona, regardless of whether they include themselves. But our geographic service area covers the entire Verde Valley, so all of eastern Yavapai County, from Jerome, Clarkdale, Cornville, Camp Verde, Sedona, Cottonwood. So it's a vast geographic area to cover, especially for behavioral health services. And for most of the time that we've been in existence, we've been primarily a behavioral health provider. But about 8 years ago, we expanded into offering primary care services as well to the community, initially starting with a small subset of people living with serious mental illness and then expanding that out to be open to the community as we felt there was a need for everybody to have whole health care, but also because we need those economies of scale to sustain that kind of care. And so that's one program that I really want to highlight in my 10 minutes, and I'm kind of competitive, so you've tapped into my competitive, like I want to win now, like I want to be the fastest, but I'll try to keep that in check. So two other programs that I want to highlight that I think are important are our Mobile Crisis to Law Enforcement pilot project that we started almost a year ago exactly. It was February 1st that we launched it, and that's in partnership with Cottonwood PD, but also every other law enforcement agency that serves the Verde Valley. And you're all probably aware that that includes many law enforcement agencies. So there's probably 8 or 9 for this little tiny geographic service area that's really not that tiny when you think about it. It's kind of micropolitan. So people call us rural, but I think we're probably not as rural as it seems. So that program, like I said, launched February 1st, and initially we had intended to provide a mobile crisis real-time response to law enforcement providers in the community when they're on the scene, and essentially take over that scene when there's a mental health component so that law enforcement could get on with what they're doing. And what we found when we started doing that was that there was such a high demand for that service across the board, not just with law enforcement. So we opened it up. We had intended to kind of, phase it out to open it up to the community, but we just sort of dove headfirst into it. So since expanding it to the community, we've responded to it to almost a little over 1,000 calls, with law enforcement and community calls combined, about almost 500 of those being to law enforcement alone since February 1st, and diverted, meaning that we community stabilized in homes or wherever we responded to, 63% of the time. And so part of how we're able to launch something like that is because, as I mentioned, we're the responsible agency for providing care for the full spectrum of behavioral health. So that means, pun intended, that means from birth to death for behavioral health for Medicaid consumers. But another part of that is that we're contracted to provide crisis services to the Verde Valley regardless of ability to pay. So however we do that is up to us, and we can be creative and innovative about how that looks, but we're only funded a certain amount of money from the Regional Behavioral Health Authority to do that. So a lot of that endeavor has been on our own dime, and kind of really just funding that to see if there was an interest or a need, and then taking it from there. And there has been an interest and a need, in case you're wondering. So the other thing I want to highlight is, along with what Elaine was saying, she's talking about just one piece of our work adjustment training program, but it's another innovative program that we launched, I think it's been about 2 years now. It was right when I took over. And it was really to try and get people living with serious mental illness some work training skills to help them be able to go get full-time employment. And the ultimate goal, obviously, being that, to promote long-term recovery, but also to get people an option where they didn't have to rely on Medicaid funds, or, they could find that meaningful activity through work. And so it was a risky endeavor in that we weren't sure if we would have the volume or demand to do that in this geographic service area, but also because, people with serious mental illness tend to have a lot of barriers to helping them get to work. So our programs consist of, the Senior Center is one area where we work, and we've done a lot of work in the greenhouse and grown all of these different things. It's just really beautiful, actually, if you get a chance to go over there and see that. But we have a cafe inside of our grounds where we can only serve food and drink to our clients and staff because of confidentiality issues. But it allows clients to be able to work in an environment and learn some of those soft skills around customer service and inventory and cash management and all those things. And we started with a cash box and a person and an espresso machine. And now it's grown to be a full-bore cafe. And then the second thing that we can have people trained in, if they're not maybe, clients that want to be on the forefront of customer service, is our fleet management system. So they learn how to manage our vehicles and the maintenance schedules, and help to maintain the car washing and all of those things. And they have these coaches that Elaine mentioned that kind of work with them to try and and help them navigate being on a job, showing up on time. How do you look? How do you present yourself? How do you do a resume? And then as they graduate from these programs, then we're able to kind of explore in the community where can we place them in full-time employment so that, and provide ongoing coaching so that they could have long-term employment. We also have another program where they can do maintenance and cleaning of one of our buildings that provides services to serious mental illness clients. And that way they can also learn that side of things. So they have marketable skills once they're done with our program. We've been able to successfully place quite a few people and even hired some of our own and have had several people go on to full-time employment with medical benefits through their employer and get completely off of Medicaid. So there's some really positive outcomes there with that program. Along with those things, though, is that we provide, like I said, the full spectrum of behavioral health services for children, general mental health clients, the seriously mentally ill, and that includes community support. So we go out into the community, we provide wraparound care for kids, we try to keep people in the community because we believe that people are best served when they're in their communities and hooked up with their natural support. So we try not to rely on the more expensive traditional settings like inpatient, acute inpatient psychiatric hospitals and things of that nature, especially for children. And we do a pretty good job of managing people in this community. But part of that is because in the Verde Valley, and I worked in the behavioral health system in Phoenix, but in the Verde Valley, we have this unique opportunity. I was talking to Doug about this the other day, to really customize services around the population that we serve because we know our population the best. I've talked at the hospital staff on many occasions too about the same thing. How can we keep these services, the hospital services and all of the things that they offer and all of the things that we offer and supplement each other and keep everything kind of here around our community because we have the ability to do that. We don't have a lot of bureaucracy to go through to get to providing some of these services. I've encountered that specifically with mobile crisis to law enforcement because in the Valley, as they're trying to launch some of these things, there's a lot of bureaucracy that in the police departments that they have to kind of work through to get those orders commanded at that level. And we've been able to do that with every single law enforcement agency here without a lot of those barriers. And it's been a really positive service for our clients, for the community members. And we're also able, because we're the provider, to get people hooked into our care. And so the last thing that I'd like to highlight about that in particular that sets Spectrum apart is that we provide same-day access for most of our services. So for primary care, psychiatry, behavioral health therapy, all of those things, you can come in same day and get an appointment. So there's not an 8 to 10 week wait to get services through us. We do screening on site to hook you up with any sort of financial eligibility that you might have. So every person that comes in, even if they have an insurance, a commercial insurance, we screen them for what they might be eligible for. So I guess in summary, I would just like to say, I would like to close with our mission statement, and that's on the sheet that I gave you, but really we're a whole healthcare provider that's focused on providing the entire spectrum of care for you, for your mind, for your body, for all of you. And I appreciate you having us here today. Thank you.
Very good, thank you. Great job, everyone except for Elaine. Appreciate you wrapping up on time. Mrs. Bremner was a host for the Cottonwood Historic Home and Building Tour. It was this year, wasn't it? Yeah. So, what was it? It was last November, I think. Yeah. November. Yeah. November. If you do good next time, we'll give you a free $5 coupon, but you have to work a little harder. All right. So, questions from council.
I had a question.
Councilmember Allen, please.
I really like the thought of the Be Well Now telemedicine. I think that is awesome. And you say that's already up and going. And
Ms. Verminger, if you wouldn't mind speaking into the mic, please. Thank you very much.
Except here, right?
Yeah, and we also have some specialties on as well. So it's primary care and specialties, and now we're looking at ways that we can give patients home monitoring equipment so that they can also call in, and we can talk to them via telemedicine as well.
Does it also provide them for prescriptions and anything like that?
Yeah. Trista, how much is it? Is it $49?
$49.
Yeah.
Just pay with your debit card.
That's amazing. Okay, you answered my
Yeah,
questions.
so we'll
Thank
get
you.
all of that information to you.
Please. I have one more.
Please.
Okay, one more question for Elaine. And we know what's going on. We've been together for a long time. I know you also deliver to Camp Verde, but Camp Verde has a senior center. What's the reason
How
for
did
that?
that come about?
Yeah, how'd that come about?
Well, when I first took over the senior centre...
Ms. Bremner, if you wouldn't mind, please speaking into the mic a little more closely.
I'm sorry.
Thank you.
Okay, is this loud enough? Thank you. Okay, when I first took over the old senior centre down in Old Town, we had a service. The service was just beginning, and what happened is Camp Verde does not have a commercial kitchen, and it's just totally out of compliance with the state in providing that service, and so. I was approached actually and asked to do something and clean up the mess regarding home-delivered meals for the residents of Camp Verde. So I took it on, and it's continued to grow. We serve approximately an average of 50 people a day just in Camp Verde, and then another 25 or 30 over in Lake Montezuma. You know, it varies, depends on whether you're having liver or roast beef, you know. But
Okay.
But anyway, that's how it came about. NACOG approached me about doing something for Camp Verde, and that's how it came
Okay,
about.
so when you get on Camp Verde's website and it says they provide meals, it's actually you providing the meals?
Yes.
Okay, that's what I
The
need.
Meals on Wheels.
Yes,
Now, yes.
thank you.
Thank you.
Very good. Any other questions from council? No? Please.
I just had a few. In follow-up about the, I think, issue with primary care providers and services here in Cottonwood, Ms. Verminger, what are some of the other challenges apart from recruiting that the system is facing with meeting the need for the primary care services?
You know, there's a nationwide shortage of primary care providers, and it's just getting exacerbated. So, you know, we're competing with Banner and, you know, everyone across the country. So I think what we've looked at is let's look at primary care more broadly. It is no longer just a primary care physician in an office, that there should be other opportunities. I think nurse practitioners are key. So we're talking to NAU about recruiting more nurse practitioners. We're looking at care coordination, so really supporting that primary care provider and providing patient education, social work, so it supports it in a more holistic way, and it takes some of that burden off of the primary care provider. Again, the telemedicine is another opportunity, working with urgent cares to expand their hours, because again, the other problem that we're seeing is that not everybody wants to see a provider from Monday through Friday. We opened up access in Camp Verde on Saturdays and Sundays, and we're open till at least 8 o'clock at night, and within 1 month it was filled up. So there's absolutely an unmet need for people to, you know, access primary care after hours. And again, we go back to financial. Spectrum has a sliding fee schedule. We have to make it affordable also. Thank you.
Please.
The other thing that I would add to that is that the reimbursement, it's kind of at a policy level too. Like the reimbursement for primary care supports currently quantity, and while the state and the nation is kind of making this shift towards integrated care and outcomes and all of that, the reimbursement hasn't quite caught up with that. So it really is still supporting quantity over quality. So primary care providers are kind of forced to see as many people as they possibly can and provide good outcomes, but that's really difficult to get at. I'm sorry, I'm losing my voice. I've been talking a lot. I should probably stop. But that's one of the bigger issues, is getting, you know, and I'm sure you see that as well, is getting to a place where primary care providers aren't so stressed about getting as many people in as they possibly can. And then in our particular situation for our primary care, because we're serving the whole population, but we also have those high needs, high cost utilizers of people with serious mental illness that are more complex and require more time, but reimbursement doesn't support that. I mean, it just doesn't. So that's a huge issue.
Thank you. Ms. Razzo, not to make you speak more and lose your voice more,
It
but
doesn't hurt,
I
so.
didn't realize that you had both a Camp Verde and it looks like a soon-to-be-opening Sedona location. Can you tell us a little bit more about the Sedona location, what services you will provide
Sure.
there, where the facility will be located?
So we currently actually have a location in Sedona where we provide outpatient behavioral health services, but what we found is a real need in the community as a whole is kind of closing that gap. We found that if you are eligible for Medicaid, you can receive a wide range of services for behavioral health and for even acute care. But if you're really wealthy, then you can afford to access those things. But there's that kind of middle class that kind of falls through the crack in terms of being able to get behavioral health services or outpatient therapy or psychiatric care in a timely fashion. So we are expanding our brand of whole health care from our current location here in Cottonwood to both Camp Verde and Sedona. So it would be the same type of care where somebody could go into Sedona same day and access all 3 or 1 of 3 or whatever combination they need. It's accessible to them there regardless if they have Medicaid or commercial insurance or their self-pay. And in Sedona in particular, we've done a lot of market analysis that there's just not any availability, or if there is psychiatric services available, it's like a 12-week wait and it's $475. So it's accessible to some but not to all. And so that's what's going to be happening in Sedona. And that location is on Hopi Drive. I think the address is on there, but it's kind of back by the fire station out there behind. We're completely renovating the building, so that's what we're in the process of doing right now. Camp Verde, we have an existing site as well, and we'll just be adding primary care to that. And again, the primary care is open to the community, so anybody can come to it, regardless if they have Medicaid or Blue Cross Blue Shield or whatever insurance they have. And the same will be true for behavioral health services here in Cottonwood. You'll be able to access those regardless of your insurance or Medicaid status, which hasn't always been the case for Spectrum.
Very good, thank you. I wanted to ask Ms. Verbinger, you mentioned that you're working with NAU to attract nurses. Are you doing the same thing with Yavapai College? What's your relationship like with Yavapai College?
Yeah, we do have a relationship with Yavapai College. We have a new nursing grad program, and in fact, I just did new employee orientation. We had a bumper crop of 7 of them. Okay. So absolutely, we're also working with Yavapai College for other technical certifications as well. But they don't have a nurse practitioner program the way NAU does.
Okay. And you mentioned recruitment and retention as serious issues. Any wonderful creative ideas for solving that problem? This is a recurring theme I'm picking up. So.
Well, I mean, I think, again, it's a combination of housing and it's a combination of, promoting the schools. And so if we could collaboratively do that, if we can work with other organizations that are promoting, that need jobs, then maybe we can do some sort of a group. We can combine our postings with theirs, so people have a one-stop shopping type of. And then I think once we get candidates here, showing them, getting them involved in the community is pretty important too, so they stay. Because the other thing that we're finding is people come and they don't feel part of the community and they leave fairly quickly. So I think getting them involved in a lot of community activities is really important.
Yeah, I'm curious, what is the main reason why they choose to leave? I'm hoping it's not pay. I don't assume it's pay.
No. Again, and that's why I go back to, I think we need to have some services for families and younger people. They leave because they want to go to, a place that is more vibrant for what they need, or the school system. So. Okay.
Very good. Thank you. Ms. Bremner, I know I'm picking on you a lot. I'm going to give you an easy one. The rebranding of your senior center. Can you talk a little bit about that? Because I know you and I have talked about that in the past. I think it's something very creative that you might want to share with everyone.
Yes. Well, the rebranding, it'll always be Verde Valley Senior Center, but for after hours, we're going to actually do a big release the early part of February. That the after hours venue, which is very rentable, will be called Verde Central Station. So if a couple wants to get married, they don't want to have their reception at the senior centre. I can't understand why, but you know, there's that stigma about seniors. And so this will, you know, be something really, they can have it at the Verde Valley, at the Verde Central Station, yes. So don't you think that's a good idea?
I do. I think it's clever. I do.
Do you all like that name? Something different? Okay.
Yeah.
So there you are.
Very good. Intergenerational programs. You mentioned that you've got some intergenerational programs going on. I think that's extremely important. Can you just tell us a little bit about what it is that you've got going on?
Well, they vary, and we're just revamping this year's things. But we work with schools on different projects. I can't think of any at the moment, but it could be even with the sewing group to teach them how to crochet and sit still for an hour, you know, just simple things like this. We encourage young people to participate in our fundraising events, and I think you'll recall March a Mile for Meals, that the Cottonwood teen group they have a presence, and so it's teach young people how to give back to the community. It's very important that they learn how to communicate with seniors, and once again, how to be part of the community and give back to the community. So, but at the moment I can't quote a specific one that we have going on today.
Okay,
yes,
thank you.
But there are more upcoming, yes.
Good. Any other questions from council? Yes, sir.
It might be important to have, because it was mentioned earlier, you know, there's been a lot of discussion in Matt.
If you wouldn't mind, Ms. Bartosh, speaking into the microphone. Thank you.
In Matt about this is the need for a detox center somewhere in the Verde Valley, and I know that can be a challenge, but you guys do have ways to get people that service as well. So.
We do. So generally the way that it works in the regional behavioral health authorities, which is Health Choice Integrated Care, in their network is that they have those types of services available to the network. So it may not be in the Verde Valley. And what we found with detox in particular is that there's not enough demand here to support a full-time facility, but we have access and we block purchase access at the detox facility in West Yavapai County. So that's typically what we use for that, for like a medical detox situation. So, and our numbers and utilization just don't demonstrate that if we built one here, there would be enough to put in there. And then our efforts really have been focused on keeping people in their homes and connecting them with those. It's kind of rare that we run into that level on a regular enough basis to support that, but we do have it available in the network. So.
Good. Any other questions for our panel? Thanks very much. Appreciate your time. Appreciate your presentations. We're going to go ahead and break for lunch. And if you wouldn't mind, just leave your cards for me on the table there. I'm going to add you to my mayoral newsletter. I've already got you on there, Elaine, so you don't. Yeah. Thanks.
I'll
Appreciate it.
grab one for you.
Okay.
Thank you.